Hypertension refers to the fact that the pressure in your body is elevated. The normal blood pressure nowadays is being defined as having a blood pressure of 130 millimeters of mercury when your heart is contracting and 80 millimeters of mercury when your heart is relaxed. Classically, hypertension doesn't have symptoms. We call it the silent killer. And that's really the concern. A lot of people will have hypertension and not even know they've got it. The problem is that for every 20 millimeters of mercury that your blood pressure is above normal limits, your lifetime risk of cardiovascular problems such as heart attacks or strokes increases by twofold. Hypertension tends to occur as you get older. Typically above the age of 50, it is not uncommon to have elevated blood pressure or hypertension. However, hypertension can also be a consequence of lifestyle. So even in young people, if you are overweight, you eat the wrong kinds of food, you do not exercise regularly, if you smoke, this can increase your blood pressure and give you a diagnosis of hypertension. Well, hypertension is typically diagnosed during annual health checkups that you may have, or if you have an insurance medical. The key thing to say here is that if you have high blood pressure during a checkup, that doesn't necessarily mean you've got hypertension. It means it's something we need to look into. We know that 25% of people who have their blood pressure checked in a clinical setting will have artifactually elevated blood pressure, something we call white coat hypertension. The key then is to look further by either asking you to take some blood pressure readings at home in a structured manner, or what we consider to be the gold standard way, which we can definitely help you with, is by putting on a blood pressure monitor for 24 hours that will take up to 40 blood pressure readings during the course of the day, and this is considered to be the gold standard way of diagnosing hypertension, as it gives you an average blood pressure for that whole day. If you have hypertension, the way we treat you is to put strategies in place to reduce your blood pressure. Now, it's critical to say that my personal practice is to really focus on your lifestyle, because often you can get your blood pressure back to normal by modifying simple things in your life. So really taking a close look at your diet, looking at your exercise program, making sure you do exercise, making sure you're sleeping enough, looking at stress management, and all of those facets of your life, if you manage to get them under control or at least make things better, can reduce and will reduce your blood pressure. Additionally, if you're overweight, we know that if you lose weight, and typically what I say is for every kilogram you lose, your blood pressure comes down by 1 millimeter of mercury. Obviously, there are tablets available, and in a significant number of people, we may need to use tablets, and that may be the case for you, but that is always in association and very much as a supplement to lifestyle modification.